The CDC is now reporting that we're seeing a 35-year high in the number of cases. That's already more than we've seen last year. And now new outbreaks are popping up in multiple states, including Arizona, Delaware, and Wyoming. For more on this, I want to bring in Dr. Akshay Syal, of course, our NBC News medical reporter. All right, Dr. Akshay, talk us through it here. 93% of the people who are getting measles don't have a vaccination, or they haven't at least said what their vaccination status is. Is it your assessment, is it health experts' assessment that that's what's really driving this outbreak?
Yeah, Hallie, that's exactly it. And, you know, we have data now to sort of back up what doctors and health officials have seen on the front lines. People just aren't that as enthusiastic about getting vaccinated as they used to be. And a lot, you know, we started to see this after COVID-19, Hallie, where people sort of started to question vaccines, especially, you know, in our doctor's appointments. People aren't exactly sure if they need them anymore. And that's what you're seeing here with the measles spread. You know, this is a very contagious illness, Hallie. About, you know, one infected person could spread this up to 18 people. If we can pull that graph back up on the screen, you can see the difference between 2024 going all the way up to this year. I mean, that is just how contagious this thing is. Those little pockets of lack of vaccination can really, really explode and take hold in the whole country. And Hallie, we need that number to get back up to 95%, that herd immunity that we all talked about during the pandemic. That is really the sweet spot for getting this virus under control.
Okay, we're watching that. We're also watching something else unrelated to this, which is this FDA panel that's been looking at peptides. Everybody's got a take on a peptide, right? They're super popular these days. But there's things that people should know about like how effective they actually are, right?
So there's the safe and effective peptides, like things like insulin and GLP-1 drugs like Ozempic. And then there's what we're talking about today, which is the wild, wild west of unregulated peptides that the FDA has assembled an advisory committee to vote on. And, you know, there's 7 peptides they're looking at, some of them including BPC 157, TB 500, KPV, MOTC. You know, these are all the chemical compounds that people are ordering off of the internet for research purposes. I've had several patients ask me about this all the time. This is probably the most common thing patients are asking me now.
Interesting.
It is, Hallie, and it's really important for people to know these aren't FDA approved. There are no randomized controlled trials. It is very much a risky thing to do right now. So this FDA committee is sort of advising the FDA on whether or not to allow compounding pharmacies to make them. All but one of them did get recommended, Hallie, tonight.
To your point, like, people can get them, like you can just buy them. When we look at the recommendations here, though, they voted against recommending a peptide that's supposed to help with sleep, right? Is there something specifically different about that one?
So the argument was, you know, the argument in general for this, Hallie, is that, you know, they're essentially saying that it's safer to get them through compounded pharmacy than getting them from some website from another country where you don't really know what you're getting. There is some merit to that. But then, you know, there is also the merit to the fact that these compounds themselves aren't really tested in randomized controlled trials with human beings. And so, yes, it is true that part will sort of be taken care of. But the larger aspect here, where patients are taking these unapproved compounds, could lead to side effects like injection site reactions, could lead to potentially tumor growth, a whole host of things that we worry about. That's why patients really need to stay away from these right now.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.